Do you prescribe Zopiclone in urgent care? Hello and welcome to this week's Urgent Bite, brought to you by the Royal New Zealand College of Urgent Care. My name is Guy Melrose and today we're looking at Zopiclone prescribing. I've attached an article in the show notes that was published on BPAC in October, which is worth reading. In 2017, Zopiclone was the 14th most prescribed drug in New Zealand, with 570,000 dispensings. BPAC feel that it has become so widely utilised because it was originally promoted as a safer alternative to benzodiazepines, but since it actually affects the same neurotransmitters, it is associated with the very same side effects. The article lists some points at the end to ensure safe prescribing of hypnotic medication. It points out the need to limit prescription lengths to under 10 days, to assess factors which contribute to a higher risk of prescribing, like history of substance abuse, concurrent mental illness, and medications like opioids that might increase adverse events, and it also highlights the need to have an exit plan and an agreed length of treatment. It also advises reviewing the need for pharmacological measures prior to issuing any repeat prescriptions. The article also highlights that withdrawal symptoms have been noted after only 2 weeks of use, which certainly indicates the need to be very mindful about the length of prescriptions and that even a short course can cause issues. So this is a good article to read and reflect upon with regards to prescribing Zopiclone in urgent care. It would seem that a person's GP is best placed to prescribe and monitor Zopiclone use in their patients, and that there are not many situations in urgent care that we could safely prescribe hypnotics for our patients. We're at risk of being targeted by drug seekers, as well as having the potential to create a reliance on a medication by not being able to adequately monitor the use in the same way as their registered GP can. So I'd be interested in the feelings of the urgent care community with regards to how you go about managing insomnia, and in particular, requests for repeat prescriptions through your clinic. As always, please send your thoughts, comments and suggestions to podcast@rnzcuc.org.nz or pop over to Facebook and leave a comment there. Please also take a moment to share the podcast with your medical colleagues on social media. We have a new podcast every Friday, with our main podcast featuring on the last Friday of the month, so do please make sure you have subscribed through a podcast app if you can, so as not to miss any new content. I look forward to seeing you all again next time, but for now, thanks for listening.